As part of Breast Cancer Awareness Month, we wanted to talk specifically about breast reconstruction, which is an important part of breast cancer treatment. Dr. Beth Collins is a double board certified plastic and reconstructive surgeon and is here to talk about options available at her practice in Guilford. Dr. Collins, nice to have you back here. Thank you. So we know that checkups are crucial when it comes to breast health, but what advice do you have for women who are initially diagnosed with breast cancer?
Yeah, this is a hard time in somebody's life. A big gasp, take a deep breath and regroup first. The first thing, of course, that you're going to be thinking is getting rid of the cancer and curing it, which is absolutely, of course, the paramount importance. But remember, there's a life after breast cancer, and you need to think about that going forward as well. So I advise people to get as much advice as they can from friends and family, people that they know who have maybe gone through this, and make sure you have a really good team of doctors who are supporting you and taking care of you. And that's going to include your breast surgeon who's going to take out the cancer. But why I'm here is because I think that there are a lot of women who never get to me who have breast cancer, and I think everybody who has a diagnosis of breast cancer should at least have a consultation with a plastic surgeon, because there's a lot of information out there that they're not going to know about, and sometimes even their surgeon may not know about it.
Sure. Because there are a lot of options for reconstructive surgery. Let's go through some of them.
Well, when you're talking to your breast surgeon, you may decide to have a lumpectomy or you may decide to have a mastectomy. And in both cases, there may be reconstructive options for you. Even in the case of a lumpectomy, there's a newer procedure that some of the breast surgeons may not be aware of or may not know that we as plastic surgeons in this community offer. And that's why people coming to me, because I could minimize the way that some of the deformities happen with even lumpectomies. And in mastectomies, you could always reconstruct a breast using either implant reconstruction or using tissue from your own body, like your lower part of your belly we could use.
Not bad idea there, right?
It is. And quite frankly, we get some very natural looking results from that. And there are people who come in who you could not even tell that they've lost their breast or even had a segment of their breast removed. So it's absolutely worth a visit to somebody. And even if you come for a consultation, you don't have to choose to do a reconstruction, but at least you've had the knowledge. So take a breath, relax.
Yeah, it's certainly not a death sentence. So, you can go back to what it was before. Dr. Collins, how long would you say recovery is? I guess it depends on the procedure that you have.
It does. I always tell women who are going for a breast reconstruction operation that they could expect to have more than one operation. It usually takes 2 or 3 stages to get things exactly where they're going to be. The first one's usually the biggest, and people tend to be out of work for a week or 2 following that and invoking their short-term disability benefits and things like that. But following that, it is a process. It's going to go on for some time. People tend to spend a little while with me in the office over the months as we get things just right. But most of the time, the actual recovery from surgery is somewhere around a week or 2. Some people take a little more, some people take a little less, depending on their social circumstances.
And Dr. Collins, you have those before and afters on your website always. Where can we find them?
So I'm on www.bethcollinsmd.com, and if you go to the breast reconstruction segment, there's all sorts of examples from any type of reconstruction that I do or anybody else who's in this community offers.
Very good, Doctor. Thank you so much for all the information. Of course, you could find Dr. Collins over at 2614 Boston Post Road. That is in Guilford. And again, her website is bethcollinsmd.com. All right, coming up next, we are heading into the kitchen to make a delicious Indian dessert. But first, take a look at this.